Hi guys, this is the introductory video for James Parker session 1. The diagnosis for this case is myocardial infarction. What you see is the general plan in front of you for this session. Of course, we'll do the usual. We'll start with a readiness assessment, and the first activity will be clinical reasoning as usual. Um, uh, and this will start with the usual problem list and problem statement. So, that everyone should have that down, and it shouldn't take very long anymore. And then Shanu Gupta has added a differential diagnosis section, which I'll go to in a minute. Those of you who were involved in tetralogy of Fallot will be somewhat familiar with some of this. This one's slightly different. It's got a slightly different emphasis to it, and I'll talk about that in a moment. Activity 2, we assume that the students do not know the diagnosis. We lead off with an EKG exercise, and that ends with James Parker's EKG, and he has an infarct in the inferior area of his heart. Okay. And then we also have a clinical pathology exercise. It mostly concentrates on the myocardial enzymes and mostly concentrates on the time course that you'll see those enzymes go up. James Parker is presenting 30 minutes after he starts to feel symptoms, so his troponin is not that high, but we are going to ask a question about would it be 4 hours later. Activity 3 starts out with some angiograms, and it ends up with one that could very well be a patient like James Parker. And then there's a gross pathology exercise where students are asked to match images to the clinical situation, all of which are MI related. For session 2, if you're wondering where it's at, that's where we're going to bring the pharmacology in. So there will be a treatment session. It'll just be in session 2. So we aren't ignoring that, obviously. Okay. Here is the differential diagnosis section of the clinical reasoning. We start off with the introduction of what you might call the cannot miss sort of differential diagnoses. This is a little bit advanced. It's not a little bit advanced. It's way advanced for these students. And if it were me and I were doing this, I think I would lead this as more of a class discussion as anything else. I think I would, you can handle it however you want as long as the point gets across. But I would literally tell them, what a can't miss diagnosis is, maybe ask them to list some on the board, just sort of as a class, because they aren't going to know, even now, many of these diseases. And so asking them to list them might be a little bit too much for them. And the same thing goes with this exercise where you're sort of like considering questions that you need to ask to make sure that you hit those can't miss diagnoses. So these are the questions here. And again, I personally think that this might be better led as a group discussion than anything else, just because of where these students are at. I might be underestimating them. I don't think I am. I don't, you can ask them to work in groups and list some of these questions, and they might get a few of them, but I would maybe try to lead a class discussion through this, okay? And then we have pertinent negatives. Again, this is a concept that you're going to have to introduce to them. They're probably not going to know anything about what a pertinent negative is. And then maybe I would lead them through a discussion of why each of these pertinent negatives is important to the case. Okay. And finally, we have guidelines for evaluation of chest pain in the emergency room. This link will lead you to this table, the article with this table in it. Okay. And then basically the question is, I think most of the students are going to know what the diagnosis is, but we're going to assume that they don't. This question will be relevant in terms of narrowing this down a little bit to acute coronary syndrome and what the odds are that that's what we have and what they would do next. And not coincidentally, what they do next will be to do a lab workup in electrocardiography. So we lead off with the ECG. This is not James Parker's ECG, it's another one. Um, this exercise was written more or less by C.Ed Shaw. I am Tom Shannon, the physiology guy. I am your contact for this. But we kind of thought that it would be a good idea to give them another case so that they basically have two under their belt at the end of the session. So this is another case where we have an EKG with an elevated ST segment. We're going to ask them to calculate the heart rate, maybe make an evaluation of the rhythm, which is just a sinus rhythm, evaluate the PR interval, and the QRS interval, and his is normal, I believe. And then we have whether hypertrophy is present, and it's not. And then we get to the meat of it, which is basically, where is there anything here that leads you to believe it might be myocardial infarction? Of course there is. There is an elevated ST segment. And the segments are in leads V1, V2, V3, and V4, which lead you to the conclusion that it is probably in the septal area and maybe anterior. Okay, so we're talking about probably the distribution for the left anterior descending circulation. Okay. And then finally, James Parker's EKG is here. His elevations are in leads 2 and leads 3, and the AVF lead. Okay, and so he has an inferior infarct, and we're going to ask them which artery that is in the angiography section in activity 3. So next we have the laboratory, the clin path, the laboratory workup, and we have an exercise basically associated with this where we ask them to ask questions about clinical pathology, when you'd expect to see certain enzymes like CKMB elevated, and then we finally get around to doing James Parker, and he has a very, very mild troponin elevation at this point, and that's because we're only 30 minutes into the event. We expect the students to be able to tell us that that's why, that it's not that high because it's still early on. And 4 hours after presentation, if the troponin's up, then that tells you that you were dealing with an MI. And because that's typically where you start to see an elevation. And in fact, this would be a really big elevation even for that time course. And so we have an inferior ST elevation in myocardial infarction. The anatomy people, Adam Wilson has distributed a reading that describes how to read an angiogram. They should be very familiar with coronary anatomy by now. And so this is an anatomy exercise related to the coronary angiography. And we're going to end up with James Parker's or something similar. So walk them through this where they label the arteries, and we have the answers here for you. We have a occlusion of the left anterior descending artery here, and then this is an occlusion of the inferior interventricular artery, which is a branch off of the right coronary, and that would be consistent with James Parker's diagnosis. Okay, and then finally we have a clin path exercise where you match the images here with the clinical scenario, and these are all MI related, and each image matches a certain scenario. Okay, and we have 4 images and 4 scenarios. And for all of these, I think all the tables should do all the problems, and then you can have one table teach back each of these questions. Okay. And that's the way that I would handle it personally. All right. So that's what we got here. Thank you for your time.